Hello, my dear patients and friends. Today, I want to have a clear and honest conversation about a topic that matters deeply to every man who's crossed the age of 60. Which urological exams are still truly necessary, and which ones you can safely let go of. Every day, men come into my office asking questions like, "Doctor, do I still need to do my prostate test every year? Is it really worth continuing with all these exams?" These questions are completely valid, and they show how today's man wants to understand his body and his health decisions, not just follow them blindly. That, in fact, is the heart of modern, evidence-based medicine. The information I'm sharing in this video is based on the official guidelines of the Brazilian Society of Urology, SBU, the American Urological Association, AUA, and the U.S. Preventive Services Task Force, USPSTF, three of the most respected medical authorities in men's health. And here's what they all agree on. Not every man over 70 needs the same tests he used to do at 50. Today, medical care is personalized. The goal is not to do more tests, but to do the right ones, with focus on quality of life and smart prevention. Let's start with the most famous test of all, the PSA, or prostate-specific antigen. For decades, PSA testing was the gold standard for early prostate cancer detection, but new studies have shown that, in older men, yearly PSA screening can often cause more stress and unnecessary procedures than real benefits. According to the AUA and USPSTF, routine PSA testing may be safely discontinued after age 70, especially for men with no urinary symptoms and a life expectancy below 10 years. Why? Because PSA levels can rise for many harmless reasons: a simple inflammation, an infection, even a long bike ride. Those small fluctuations often lead to biopsies that confirm nothing but a healthy, enlarged prostate. Now, for healthy, active men who have a strong family history of prostate cancer, a father or brother diagnosed before 65, your doctor might still recommend periodic testing. But the key word here is individualization, a shared decision between patient and physician. Then we have the digital rectal exam, or prostate physical exam. For a long time, it was a mandatory part of screening. Today, we know that for men over 70 with stable PSA levels and no symptoms, the rectal exam can often be skipped. However, if you experience a weak urine flow, urgency, discomfort, or blood in your urine, then yes, this simple exam remains a vital diagnostic tool. Next, let's talk about hormonal testing, especially testosterone. Many men ask if they should measure testosterone every year. The answer is only if you have symptoms of low T, things like decreased libido, chronic fatigue, loss of muscle mass, or irritability. Doing the test without symptoms doesn't bring benefit and may cause unnecessary concern. The transrectal prostate ultrasound is another test that no longer needs to be done routinely. It should be reserved for specific cases like abnormal PSA results, concerning symptoms, or findings on physical exam. On the other hand, there are some exams that remain essential at any age. A simple urinalysis is one of them. It helps detect infections, bleeding, or kidney issues. And blood tests for creatinine and urea remain important to monitor kidney function, which can naturally decline with age or certain medications. An ultrasound of the kidneys and bladder is also valuable whenever there's pain, urinary retention, or visible blood in the urine. It's non-invasive, fast, and can reveal stones, blockages, or early-stage tumors that are much easier to treat when detected promptly. So, what's really changed in modern urology is the philosophy behind it. We now practice personalized medicine, not one-size-fits-all. That means we treat the individual, not the number on the birthday cake. Some 75-year-olds are healthier and more active than men 20 years younger, and our medical approach must reflect that. The AUA, SBU, and USPSTF all emphasize that decisions about prostate screening and urological testing must be shared and evidence-based. No patient should go through invasive procedures without a clear reason and potential benefit. As a urologist, my mission is not just to request exams, but to guide, explain, and support. The truth is, more important than collecting lab results is learning to listen to your own body. Pay attention to changes in your urine flow. Notice discomfort. Keep track of how often you wake up at night to urinate, and talk about these things without embarrassment. And yes, emotional health is just as important. Many men still find it difficult to open up about intimate issues like erectile dysfunction, incontinence, or loss of desire. But silence only delays recovery. Today, we have safe, effective, and discreet treatments for nearly every urological and sexual concern. So if you're a man over 60, here's my message to you. You don't need every test every year. You need the right tests at the right time, guided by your doctor. PSA and rectal exams can often be spaced out or discontinued safely, but regular medical follow-ups remain essential. Because the goal is not to do less medicine, it's to do better medicine. Aging well is not about avoiding doctors, but about choosing wisely what truly adds value to your health. And remember, the information in this video comes directly from official medical guidelines from the American Urological Association, the Brazilian Society of Urology, and the U.S. Preventive Services Task Force. Organizations dedicated to helping men live longer, healthier lives with clarity and confidence. I'm Dr. Rena Loeb, urologist and pelvic surgeon, and I'm here to help you navigate aging with strength, wisdom, and dignity. If this video helped you understand your health a little better, please give it a thumbs up, share it with other men in your life, and subscribe for more science-based guidance on urology and wellness. Because caring for your intimate health has no age limit, and making informed choices is the smartest form of prevention. Take care, and I'll see you in the next video.